Hello, everyone. My name is Patty Austin. I'm a quality improvement specialist with Quality Insights, and I'd like to welcome you to Microlearn Episode 4, Sustainability, part of our Back to Basics QAPI series on infection control. Today, we'll explore how to embed QAPI improvements into daily operations to ensure the long-term success of your performance improvement projects. Let's dive in. Sustainability is a key element of a strong QAPI plan. It's the fifth and final element in the QAPI framework, focusing on systematic analysis and systemic action. Both are essential for embedding improvements into your facility's culture and making them stick. To achieve sustainability, you need a good grasp of two critical components: systematic analysis and systemic action. Systematic analysis is all about taking a step-by-step approach to thoroughly investigate a problem. Processes like root cause analysis, using tools like the 5 whys or fishbone diagrams, can help you to identify the true cause of issues, allowing you to create the change that lasts. Systemic action ensures that the solutions you do identify don't just sit on paper, that they're fully integrated into your daily practice. This might mean updating care protocols, educating staff, or conducting regular audits. When you combine analysis with action, you move from simply identifying problems to implementing meaningful, lasting change. Let's break that down even further. Systematic analysis involves using structured methods to identify and understand problems. You'll want to prioritize the most impactful issues. You'll want to bring the right team members to the table and collect data to guide decisions. Again, using tools like root cause analysis to dig deeper into problems that you uncover will promote the idea of lasting change. From there, small PDSA cycles allow you to test solutions effectively. Systemic action takes these solutions and embeds them into the organization. This involves engaging leadership, understanding workflows, fostering a culture of continual improvement, and celebrating your success. Together, these steps transform insights into sustainable action. Thinking back to element 2 in our framework, leadership plays a pivotal role in sustaining QAPI initiatives. Leaders set the tone for quality improvement by connecting efforts to real people and outcomes. Sharing impactful stories, creating QAPI champions, and supporting teams with the tools and resources they need are all ways that leaders can make quality part of the organization's DNA. Sustaining QAPI efforts requires effective and inclusive communication with staff at all levels of the organization. Open and consistent communication fosters collaboration, builds trust, and ensures that everyone feels valued as a part of the quality improvement process. Encourage open door communication by establishing that open door policy where staff feels comfortable sharing their concerns, ideas, and observations. Leaders should be approachable and willing to listen, creating an environment where feedback is welcome and acted on. To ensure sustainability, communication must reach staff across all shifts and departments. Schedule regular opportunities for updates and feedback that include night and weekend staff, as well as all interdisciplinary team members. Breaking down silos between departments ensures that everyone has a shared understanding of the goals and contributes to the success. A just culture is essential to sustainability. This approach promotes accountability and learning instead of blame when problems arise. Leaders should emphasize safety, learning, and improvement over punishment. They should reinforce that identifying system-level issues is more important than assigning fault. Most importantly, they should foster a safe space for staff to raise concerns and share insights without fear of retaliation. Every staff member plays a role in QAPI, regardless of their position. Setting the expectation that quality is a shared responsibility empowers staff to take ownership of improvements and fosters a sense of pride in their contributions. Sustainability is only possible with strong teamwork. Encourage collaboration by providing opportunities for team-based problem solving and decision-making. Recognize and celebrate successful team efforts to reinforce the importance of working together toward a shared goal. By fostering open communication, promoting just culture, and emphasizing collaboration, leaders can ensure that staff remain engaged and committed to sustaining QAPI improvements. Residents and families play a vital role in sustaining QAPI initiatives. Their perspective provides valuable insights and helps to shape the culture of continuous improvement that focuses on person-centered care. Engaging them through effective communication builds trust and strengthens the commitment to quality. Sustainability requires understanding the experience of care from the resident's perspective. Take time to step into their shoes to assess how policies, procedures, and daily interactions affect their quality of life. By viewing care through this lens, teams can identify opportunities to improve processes, enhance comfort, and ensure dignity and respect in all aspects of care delivery. Foster open communication by sharing updates about QAPI initiatives, goals, and outcomes with residents and families. Regularly discuss how these efforts impact their care and quality of life. Transparency builds trust and strengthens partnerships. Create opportunities for residents and families to share their concerns, ideas, and feedback. This can include hosting regular family and resident council meetings, providing suggestion boxes or digital platforms for anonymous feedback, conducting satisfaction surveys to gather insights and identify areas for improvement, but most importantly, foster a sense of having a shared goal for care that you work on together to achieve results and avoid actions that lead to residents feeling acted upon. Empower residents and families by involving them in the QAPI discussions that you're having and projects where appropriate. Their participation ensures that initiatives align with their needs and priorities. Strong relationships between staff, residents, and families lay the foundation for effective communication. Focus on person-centered care by listening to residents' and families' preferences, addressing concerns promptly, and treating them as partners in the care planning quality improvement process. Recognize and celebrate the positive outcomes achieved through QAPI efforts with residents and families. This not only reinforces the importance of their improvement, but also builds momentum for sustaining improvements over time. By prioritizing transparent, inclusive, and meaningful communication, and by consistently viewing care through the lens of the resident, organizations can ensure that residents and families remain active participants in the QAPI process, helping to sustain improvements and strengthen trust across the care community. Sustainability requires actions that address root causes at a system level. Weak actions like relying on memory or adding a policy are short-lived. Intermediate actions like using checklists provide some support but still depend on human effort. Strong efforts, on the other hand, redesign processes to prevent errors. Think physical changes, forcing functions, or simplified workflows. Prioritize these strong actions for lasting, meaningful improvement. By prioritizing strong actions, we create a system that supports sustainability. These actions don't just address systems, but tackle the root cause of issues, leading to lasting improvement. When considering solutions, ask yourself, are we creating sustainable actions that will endure, or are we relying on temporary fixes? Let's visit with our nursing home team as we see how temporary fixes lead to unwanted outcomes. Our cast of characters today includes our director of nursing, Ima on the ball, our infection control nurse, Ivy got the chops, the housekeeping supervisor, Ali keep it clean, Norman needs to know, a resident family member, and Rita Regulator, our Department of Health surveyor. Let's listen as our DON, I'm on the ball, the infection control nurse, Ivy got the chops, and the housekeeping supervisor, Ali keeping it clean, discuss staff shortages and their impact on infection control.
Hi, everyone. I brought us together today to talk about concerns related with my observations of our infection control efforts. Just because we are short-staffed, we can't let infection control slip. So I've brought in agency help for house cleaning. 3 workers will start today.
That's good to hear. I'm convinced that poor cleaning is driving the spike in respiratory illnesses, especially high-touch areas like the dining room.
I'm relieved I have more help. I'll stress to them how crucial it is to thoroughly clean the dining room, but sometimes temp staff miss the mark.
Our temporary staff has been on the job for about a week now, and during routine rounds, the DON notices dirty surfaces and improperly stored PPE in the dining room. As she's considering what action to take, a family member Norma needs to know approaches.
Ima, this dining room is filthy. The tables are dirty, and I even see scattered masks and gloves. I've been telling you how worried I am about mom getting sick because she's immunocompromised, and this is exactly why. I won't have her eating in here anymore until this changes.
I do hear you, Norma. We have brought in agency staff since last week, so things should improve soon. We truly are doing the best we can.
Your best isn't enough. People are already sick on her hall. Someone needs to fix this.
Norma walks away, pulling her cell phone from her purse. The following day, our team is surprised with a complaint survey that lasts all day. Let's listen in on the exit conference.
Miss On the Ball, we've identified lapses in cleaning protocols and PPE storage, which align with this facility's respiratory illness outbreak.
Yes, we're aware of the issue and have brought in agency staff to help with this.
It's not sufficient. In speaking with the agency staff, they have received no infection control specific training and are failing to maintain even basic infection control standards. The inconsistent cleaning is compromising resident safety. With the current number of residents who attend social dining currently having respiratory illness, we have identified actual harm and immediate action is needed.
Our team gathers for a post-survey discussion.
Thanks everyone for your hard work today. I know it's never easy with the surveyor in the facility, but they did confirm what we feared. Our temporary fix isn't working. Poor cleaning is fueling the outbreak.
Untrained staff can't follow infection protocols. We need proper training and long-term solutions.
Agreed. Let's implement thorough training for all staff, temporary or permanent.
And let's focus on retention. Constant turnover is disrupting infection control.
I completely agree. We'll launch a training program, reinforce it regularly, and roll out audits to ensure compliance. Let's consider asking Norma to be part of our auditing process. We want her to understand that we hear her voice and value her input. These interventions should put us on the path to a sustainable solution.
This scenario showcases what can happen when a quick fix is applied without considering how systems will be impacted without a systematic way of ensuring you're going to get the results that you're looking for. In summary, sustainability in QAPI requires systematic analysis, systemic action, leadership engagement, effective communication, and the involvement of residents and families. By focusing on strong, system-level improvements, you'll drive impactful, enduring change. Thank you for joining episode 4 of Back to Basics QAPI. Be sure to revisit episodes 1 through 3 for insights into the QAPI framework, data systems, feedback and monitoring, and performance improvement projects. If you would like to discuss these ideas in more detail, contact your quality improvement specialists. Together, we can build a stronger, more sustainable QAPI program.